When I was young, I kind of was involved in the mental health system to a point where I was homeless, and then I went into a hostel. It was quite a traumatic period. I understand whenever someone's ill, there's a traumatic period, but I wonder if the health service was providing a service, and that also impacts on families, and it was quite a terrible time.
Michael's journey has been a long one. It's been fraught with situations that were heartbreaking, that affected my whole family. But most of all, it was Michael's life that I had to fight for. Michael couldn't fight for his life. It perplexes me when professionals always put on a care plan, if you are going into crisis, you need to contact this number. He doesn't know he's in crisis when he's in it. He's that mentally unwell. It's the family that knows. But it's very rarely that the family's listened to.
People only get that help after they've gone down the spiral period, when the destruction has all taken place, and then they only get help when it is really terrible, where I'm saying, is there kind of therapy that intervenes slightly earlier to prevent that period of destruction? I feel that medication is, too, it's just given to deal with things quickly, and I understand that, but sometimes if someone needs therapy to deal with their mental health issues and life, then I think it's important not to just chuck pills out, and it seems to be that's just enough. And I have had it said to me from my psychiatrist that what it is, I understand it's better to take the tablets than obviously be in a bad place, but then you're back in the system through the physical health, because the tablets may have taken a toll on your liver and stuff.
We have GPs who, first of all, when we know we're not right, or we know a member of our family's not right, we take them to. They then make a referral. 8 weeks? Really? 8 weeks is okay if you're kind of waiting for a blood test, or you're waiting for a few scans where they can make a decision that it's not life-threatening, and I trust a GP to do that. But when you're living with somebody that you know has got suicidal thoughts, 8 weeks is not good enough. 8 hours is not good enough. We need GPs, we need consultants physically and consultants mentally to come together. The two, physical and mental, need to come together. They need to work together. Where you have adult social care, they need to be aware of how you need to prioritise mental health and how they need to listen immediately. Now, I know what I'm asking. Someone's going to say the funding isn't there. Well, quite simply, it has to be there, because this problem is not going to go away. There is lack of communication. There is no speediness in the service to get someone seen immediately. And the follow-up care is not good enough. Michael, as I've said, is well, but he's always going to have this condition. So when he falls down, I need to be able to access help straight away. So it needs to flag up on the system. Right, okay, let's get Michael there. Let's pick Michael up, let's capture him, let's put the tools in place to get him steady again, then we can send him on his way again. For me to go back into that system to get him help is soul destroying, and it's like wading through treacle. That has to change. Michael's journey is not complete. He is well. He is functioning better than I ever thought he would. He has a life. His journey, my journey, is one I actually wouldn't change, because it's taught both of us to accept and to understand mental health, so much so that I believe we would both love to be advocates and campaigners, to ask those that are in charge, those that are in position, MPs, health professionals, governing bodies, to listen to what we are saying. We are prepared to talk to you, and for you to talk to us, to change this system that is at crisis point itself, critical, and there are so many lives at stake.